A very good day, my dear friends. Can you imagine what is there on the screen? Pathology and NEET. I thought I would try something different for the students, not limited to pathology, but across the entire undergraduate, or if possible, touching the postgraduate also. Because you would see that the role of pathology is not confined to the realms of the second MBBS or the basic sciences, whatever it is for. In this series, I hope I am able to deliver the importance of pathology for your NEET exams. Pathetic for NEET. Most welcome. The history in the first case. This is a story by a famous physician who once saw this picture appear and disappear in a patient of his. He made a diagnosis, and that still carries his name. So, can you people guess or recollect the diagnosis? It is a clinical diagnosis. Okay, the clue is given to you. The diagnosis is a bleeding disorder, a paraneoplastic syndrome, a triple response, and neovascularization. If at all you are able to click the diagnosis, you are supposed to explain. So always the question should take us back to the answer and to the book. It is not directly just ticking the right answer. Anyway, let us see what else is there for us. Later, he saw, smiled, and made the diagnosis on himself. What he had diagnosed in a patient, he saw and he made the diagnosis on himself. Courtesy Bridgman images for this person. I hope you are able to diagnose. Fortunately or unfortunately, pictures are a little difficult to retrieve from the net, whereas facts can be. Who is this man and what is the diagnosis? The diagnosis is, as I told you earlier, a bleeding disorder, paraneoplastic syndrome, triple response, and neovascularization. So this was what that was seen histologically. So the diagnosis is a paraneoplastic syndrome, and it is called R.A.T.S syndrome, and that is the person on the screen. For undergraduates, you find that it can be an inflammation of the blood vessel, and sometimes it is called as thrombophlebitis migrans or migratory thrombophlebitis. It appears, stays, disappears to appear somewhere else. Usually it is because of venous thrombus in superficial veins. Most common in glioma, I do not know why. Pancreatic, lung or gastric adenocarcinoma, well known. Glioma form the majority of it, 25%. Phlegmasia, on the other hand, means white veins, common in pregnancy. And sanguinolent is again a term that was introduced by R.A.T.S, which means effusion into the body cavities. So, and for postgraduates, I hope you are able to follow this picture. We all know that heparin is an anticoagulant. Now, what happens in this case is there is a stasis, and it can be because of the pressure of the tumor or because of bed rest or whatsoever, as a result of which there is a clot that is being formed. On the contrary, you find that heparinase is being released by the tumor cells. This leads to the dissection of the heparin and the liberation. So there is a clot as well as a bleed. Also, you find that this can be precipitated by many a chemotherapeutic agent that is there. So these are the things. Hypercoagulability can be because of the stasis, the chemotherapy, and heparinase by the tumor cells. Thanks to this wonderful reference from Wikipedia.